Thank you. So first of all, thank you for inviting me also as a speaker at this conference. In my talk, I will focus on EDS and relationship functioning, because when I heard about, I have to press hard, they said. Okay. When I heard about the topic of this conference and what are unmet needs, I thought, okay, from a psychological perspective, what could be unmet needs? And therefore, I would like to start with a case. It concerns a man of 50 years old who has a diagnosis of vascular EDS. The man has 3 children, 2 have inherited the disease, 1 has not. So the man is well known in our hospital for his medical follow-up, for his physiotherapy and also psychological follow-up. I met him a few years ago during a hospitalization because he had an arterial dissection at the time. So, and as is with the case with this man, and as also with the case with a lot of other patients, there is a strong focus on the individual. And that later on, recently he had a new dissection, and I received a phone call from the attending physician whether I would like to see this man, but this time together with his wife, with his female partner, because at this time she is struggling more with the diagnosis, with the disease than the patient himself, because she lives with a partner who has vascular EDS and 2 of her children are also affected. So when I was thinking about, okay, what could be unmet needs, I think that a clear need is to focus more on the interrelationships. Here you can see that we see the patient as an individual, but the patient is also a partner of somebody, who is a parent of someone. He has a social life, a professional life, a social life, and that counts for everybody in the family. Everybody exists as an individual, but then I was thinking, okay, for each individual, how does a diagnosis of vascular or classical EDS could affect the functioning as a family. But because the time is limited and there are a lot of complex relationships, I would like to focus especially on the couple functioning for this presentation. So I started looking, okay, what do we know in the literature about the relationship and the sexual functioning among couples where one of the person has EDS? And in fact, it was a bit disappointing because I noticed that there is almost no literature available on the relationship functioning and the sexual functioning among these specific couples. However, an EDS diagnosis results in considerable physical, emotional, and psychological burden on both the patient and the parent. So that's why I broadened my search and I focused more on relationship functioning and chronic disease in general. And we all know that the diagnosis of a chronic disease has a clear impact on relationship quality and on different domains of this relationship quality. And I will go a bit more in depth on each of these domains. First, there is the aspect of communication. We all know that if we want to be in a happy relationship, we have to communicate with our partner. But especially this is true for people who are suffering from a chronic disease, because they really need to discuss the medical needs, the treatment plans, and the emotional challenges that go along with the diagnosis. Because misunderstandings can occur if there is a lack of communication, which leads to frustration and resentment. We also see that couples who are able to talk about their stress, that they experience a positive effect as a patient themselves and also experience more support by their healthy partner. Next, there is a theme of emotional well-being. The chronic disease leads to emotional stress for both the patient and his or her partner. It's normal that there are feelings of sadness, frustration, guilt, anxiety. It is already mentioned in the earlier presentations. And the partner might feel overwhelmed with caregiving responsibilities or worry about the well-being of their loved one because of less psychological well-being themselves, with a burden because they provide physical assistance to their partner, and they also might experience a decrease in relationship satisfaction. Next, there is a theme of role changes. Chronic disease can disrupt established roles in a relationship. For example, if one partner is a primary breadwinner, the decreased ability to work can lead to financial stress. So we have to be aware that role reversal can cause emotional strain and ask adjustment from couples. Support is another important theme when we talk about couples. Partners need to support each other with the challenges that go along with the chronic disease. However, if one partner becomes a primary caregiver, it can strain the relationship if the caregiving demands become too overwhelming. So here you can also see, you can in fact see it on a continuum when there is on the one hand a lack of involvement of the partner. The patient can perceive that he has to cope with the disease alone and he cannot count on his partner. But on the other hand, when there is an over-involvement of the partner, patients may perceive that the partner is too controlling and is too overprotecting. When we talk about intimacy, this can also be impacted by the condition due to the physical limitation, due to pain, due to fatigue, or due to change in body image that results from the disease, which can lead to decreased sexual activity and emotional distance from the partners. And when I was looking in the literature, I found some studies available on sexual dysfunction at the individual level, but in fact, in my opinion, no studies are published on the sexual satisfaction and on sexual communication at the relation level when we talk about couples who are confronted with this kind of diagnosis. Furthermore, the quality time, we know that a chronic disease might limit the kind of activities that people are doing together as a couple, which also can lead to a decreased sense of companionship if these activities are no longer possible as a couple. So we do know that if people or couples can actively engage in activities that they like doing together, there is an increase in relationship satisfaction, they can better cope with the illness themselves, and there is in general a better health-related quality of life. Social isolation, at last, chronic disease might limit the ability to engage or to act in social events, which leads to feelings of isolation. This is also already management during the pain session, and this can impact the couple's overall support network and their sense of belonging. So to summarize, I think that for couples, it's really a balancing act. They have to adapt all the time, they have all the time to find new ways to cope with a chronic stressor in their relationship. So I think what is important to keep in mind that in close relationship, stress affects both partners due to their interdependence. Dealing with a chronic stressor is not an isolated, but is a shared experience for both partners. And both partners deal better with the chronic disease if they are able to communicate about the experienced stress, if they feel supported by their partner, and if they share similar disease perceptions. So we talked about the unmet needs that, in my opinion, from a psychological perspective are important, but what could be strategies and solutions for these unmet needs? Maybe could it be an idea to focus on couple intervention? What would happen if we target both the patient and the partner? Because we all know that a chronic disease has an impact on the partner, has an impact on the relationship. So this model, in fact, shows that the influence of the patient on the health status is influenced by, first, the patient's psychological functioning, how the patient thinks and feels, also by the health behaviors, and also by the relationship functioning. What I think is important in this model is that the relationship functioning has a direct influence on the health status of the patient through some biological parameters, but also indirectly through the influence relationship has on the patient's psychological functioning. So what I would suggest, or what in my opinion could be important, is that there is a shared responsibility for both the healthcare professionals and the patients, that I think it is important that health professionals just ask relational questions. That they not only ask how are you feeling, but also how does the EDS affect your life as a couple? How are you dealing with the pain, but also how does the pain interfere with your life as a couple? How does the EDS interfere with your daily life, but also ask questions about how does the EDS affect your intimacy level with your partner. On the other hand, I also think it is important for patients that they just tell, even when it's not asked, when they are in a consultation, that they not only say, I'm okay or I'm not okay, but we are having a tough time as a couple. My partner is struggling with the disease, so that on both sides we are aware that the relation is important. Because a boat doesn't move forward if each one is rowing in their own direction, I think that we have to take care of couples dealing with stress and not only focus on the individual patients. Thank you for listening.